We do turn now to the coronavirus pandemic and growing concern about new variants possibly leading to another winter surge. The CDC saying early data suggests these new variants may be able to spread more easily and evade immunity from vaccinations and previous infection. This as less than 40% of Americans over age 50 have had their second booster doses. Let's bring in ABC News medical contributor Dr. Darian Sutton. Dr. Sutton, good morning to you. It's always great to have you. So let's start here with the BA.5 Omicron subvariant. It's been the dominant strain throughout the summer, but the CDC is now reporting that other subvariants make up roughly 1/3 of new cases. Could this be an indication of what's to come?
Absolutely. Good morning, Whit. So these new subvariants represent a small but fast-growing group of this Omicron variant. And right now, as you said, new data shows that they're not increasing the risk of hospitalization and death. However, there is evidence that they're able to evade immune protection, specifically for those who have had a prior infection and also for those who are not up to date on their vaccines. Right now, it seems that the majority of the cases are in the Northeast, as New York and New Jersey have approximately 20% of the total cases of this new subvariant.
So speaking of that protection, those new bivalent vaccines now available, and just days ago they were authorized for children 5 and older. What should people consider with these vaccines, and how could they be impacted by these new variants?
Well, I think that everyone should go out and get their vaccine if they're eligible. I'm approximately 2 weeks after my covalent booster myself. Right now, they're indicated for anyone above the age of 5. And if you've had a recent infection, you can wait approximately 2 months, but the general science says you can probably wait 3 months after a past infection to get this bivalent booster. New data is showing that these boosters help produce a strong immune response against the Omicron variant. Now, although we don't have the data yet on this new subset, we can only assume that it probably confers a strong level of protection. So again, I recommend that if you're eligible to go out and get vaccinated.
All right, Dr. Sutton, as always, thank you for your time this morning. And also stay tuned to This Week later this morning for an interview with Dr. Anthony Fauci, reflecting on his 5 decades of public service and an inside look at the government's response to the COVID-19 pandemic. Plus, George Stephanopoulos one-on-one with Representative Adam Kinzinger about Thursday's January 6 hearing, and he'll press Transportation Secretary Pete Buttigieg about the latest inflation report and when Americans can expect some relief from rising prices.
Well, hey there, GMA fans. Robin Roberts here. Thanks for checking out our YouTube channel. Lots of great stuff here. So go on, click the subscribe button right over here to get more of awesome videos and content from GMA every day, anytime. We thank you for watching, and we'll see you in the morning on GMA.